Cervical radicular syndrome starts as a simple mechanical failure. A small neck disc loses structural integrity and presses outward, pinning a spinal nerve against bone. That tiny point of pressure creates a cascade of severe neurological symptoms. Patients experience intense, radiating pain, numbness, and tingling that shoots all the way down their arm. When they sit down with a doctor, they face a specific dilemma. They can manage it conservatively, using painkillers, physical therapy, and time, or they can undergo an anterior discectomy, a surgical procedure to physically decompress the nerve. At the moment of diagnosis, the exact method doesn't really matter to the patient. They simply want the agony in their arm to stop. To see which path actually works better, we can look at the Casanino trial. This study tracked 141 patients over 2 years, comparing those who chose conservative management with those who opted for surgery. These spaghetti plots track the patient's arm pain. Looking at the top row, you can see how wildly unpredictable the recovery process is in the early weeks. The pain levels jump up and down constantly. This chart compares the average drop in arm pain at the 1-year mark. Despite the chaotic start, both the conservative group and the surgical group arrived at almost exactly the same result, a massive 70% reduction in arm pain. If resting and taking medication effectively fixes the arm, going under general anesthesia for neck surgery seems entirely unnecessary. But evaluating these treatments solely on the first year of arm pain ignores what happens to the rest of the spine. When the Casino trial followed these same patients out to 104 weeks, 2 full years after they started treatment, the data shifted. This graph tracks localized neck pain. Pay attention to the 52-week mark. A massive gap opens. For surgical patients, the red line plummets to a 67% reduction. But the conservative group's blue line creeps back up in year 2, leaving only a 34% reduction. These 2 years of data show that surgery resolves a deep, localized neck ache that conservative management leaves behind, even though both treatments eventually quiet the arm. Why does removing a pinched nerve to fix someone's arm end up curing a long-term ache in their neck? When a spinal disc degenerates and flattens, it ruins the natural healthy curve of the cervical spine. The spine relies on sagittal balance, a precise geometric alignment. When that curve flattens, it creates constant pulling mechanical strain on the joints in the back of the neck. During surgery, doctors do not simply pull the damaged disc out. They insert a structural peak cage, a small rigid spacer, directly into the collapsed void. This cage acts like a jack. It physically forces the 2 vertebrae back apart to their original angle, actively inducing the natural inward curve of the spine. By restoring that precise geometry, the surgery permanently removes the underlying mechanical stress. Conservative treatment remains an excellent, highly effective method for giving an inflamed nerve root the time it needs to calm down. But physical therapy and painkillers cannot rebuild a collapsed spinal architecture. This structural reality changes the conversation patients should have with their neurologists. An anterior discectomy functions as a mechanical restoration that rebuilds the spine's geometry, moving beyond the simple goal of stopping arm pain. Evaluating these options requires looking past the first 6 months of acute symptoms and planning for the physical realities of the next 2 years. Choosing surgery means actively resetting the sagittal balance, ensuring the long-term mechanical health of the entire neck.